use of radioactive substances in the evaluation of the musculoskeletal system has a relatively long history. In nuclear medicine, bones can use radiopharmaceuticals and shows the effects of injury or disease such as cancer or infection on the bones. It also shows whether there has been any improvement or deterioration in a bone abnormality after treatment. Bone scintigraphy is exclusively sensitive to bone turnover, detecting as little as 5% change. In specific instances, this can provide evidence of bone disease or dysfunction before bone changes are appreciated on conventional radiography. Multiple conditions such as fracture, malignancies, infections, and other disorders of bone turnover can also be seen, such as fibrous dysplasia and avascular necrosis. Soft tissue conditions such as cellulitis and complex regional pain syndrome can be seen in certain phases of the scan. Today on your favorite Health TV talk show, The Physicians, we'll be talking about the role of nuclear medicine in bone disorders. Do stay tuned.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day on your favorite Health TV talk show, The Physicians, where, of course, your health is our business. My name is Dr. Memuna Yusuf Kadri, and with me in the studio is the amazing co-host, lovely, beautiful
Dr. Martina Agbere. Thank you, thank you.
You look lovely.
Oh, thank you, Dr. Memuna. You too, you look good.
Thank you. But you know, the topic for today is not so good.
Not so good. Well, we're going to be talking about the role of nuclear medicine in bone diseases.
Nuclear medicine, bone disease.
Bone on its own is hard. They now add nuclear to it. Nuclear, like the astronauts. They're going to space.
Which day is our this thing taking off? Let's go to the space with some people.
At least to go and do some study.
But I think this is very important when it comes to nuclear imaging and bone disorders or bone diseases, because it's always good, you know, with the expert that has been talking to us on nuclear medicine. I remember saying specifically that nuclear medicine is complementary. It's not coming to unseat other diagnostic tools, but complementary in the sense that if you come with a particular medical condition, you now have more options as against limited options that you had before.
Why I'm even more excited is because with nuclear medicine, from what we have learned, it will be easier to diagnose faster than the normal radiotherapy that you radiation that you will do, X-rays that you want to do, and it also helps in the management and treatment of a disease condition. It's easier to handle soft tissues, but when it comes to bone,
we have an expert coming, so please
let's see how she will crack it.
Welcome back. If you are just joining us, this is your favorite Health TV talk show, The Physicians, where your health is our business. Today on the show, we are talking about nuclear medicine in bone disorders. What's the role of nuclear medicine? And of course, with us in the studio, if you have missed our other previous topics, you've missed greatly. Just go to our YouTube page and look for the nuclear medicine, the different roles it plays in thyroid disorder, and of course what nuclear medicine and molecular imaging is all about. But today we are taking it a top higher by talking about the role of nuclear medicine in bone disorders. And of course, with us in the studio is the amazing, beautiful, elegant, fabulous, walking encyclopedia, no other person than Dr. JALEELAT MOMODU, who is a nuclear medicine physician and of course a molecular imaging specialist trained in South Africa, but our experience spans across.
Thank you so much for having me. So nuclear medicine is a specialty of medicine where we use small amounts of radiation, known as radiopharmaceuticals or radioisotopes, to image and treat different disease conditions. So these radiopharmaceuticals could be administered intravenously, orally, or by inhalation. And then as it passes through the system, we have special cameras that pick up the radiation, which is emitting from the patient, and then the camera now converts it into an image that we can read and interpret. So coming down to bone disorders, nuclear medicine is also, or molecular imaging can also be defined as functional imaging. So we image functional processes. And when you have a bone pathology, there are several processes that occur. There's increased blood flow, there might be pain, there's accumulation of, like if you have an infection, there will be accumulation of white blood cells. So nuclear medicine utilizes all these processes in administering radioisotopes that we can now use to image.
Really interesting.
So, but no, now we're talking about the functioning part of radio imaging or
Yes.
molecular imaging, and we are relating it to bone disorders.
Yes.
How does that differ from CT scan, MRI? What is it going to show specifically that a CT scan that naturally is about the structure,
Yes.
differ from? Will it be of more benefit than CT scan or MRI?
Okay, so usually in the normal process of a pathology, you would have changes in function, or functional changes will occur before you have structural changes. So for example, if a patient has cancer and there is metastasis to bone, for example,
Okay.
because bone has been invaded by these cancer cells, there's an increased blood flow, there's increased bone remodeling, because the normal physiologic response is that the bone is trying to overcome. So with that increased bone remodeling, there's increased blood supply to the area. In the early stages, a nuclear medicine scan that is attracted, or a nuclear medicine radioisotope that is attracted to an area with increased bone remodeling and increased blood flow will pick up changes quicker than a CT scan or an X-ray, for example, which is waiting for changes to occur in the structure. Another important thing to note, especially for cancers, is when we remember the structure of the bone, there's the inner softer part, which is called the medulla, and the outer part, which is called the cortex. So a lot of these changes start in the medulla before you now begin to see changes in the outer cortex. So a nuclear medicine scan will pick up those initial changes before your regular conventional imaging.
Okay. So apart from the diagnosis of cancer spread to bone, apart from that, having that diagnosis of cancer spread to bone, are there other uses of a bone scan?
Oh, absolutely. Bone scan is one of the most common nuclear medicine studies offered. And a bone scan is relevant for even pediatric cases up to adults. So you are talking about conditions like osteomyelitis. You are talking about bone cancers, primary bone cancers from pediatric to adult patients. In sports injuries, nuclear medicine bone scan is also indicated up until for children and adults, because the radiation exposure is comparatively lower. In fact, it's like a tenth of what you will get from a conventional CT scan, a bone scan. So it's considered safer, and then especially for pediatric patients where you do multiple scans to make your diagnosis, and then you need to follow up the treatment and monitor the bone, you might prefer to do a bone scan, because then you are limiting the radiation exposure to the child. So to answer your question, nuclear medicine is indicated or plays a role in benign bone conditions like infections. Then you have there's osteomyelitis, and then things like fibrous dysplasia and other benign bone conditions, in addition to malignancies.
So at this point, can I say it should be best practices if somebody has osteomyelitis and is benign, that they must have nuclear imaging to make sure that no other issues aside, you know, they would just treat the person and say, go home, everything has been done and all that. Can we say it is best practice to seal it up with a nuclear imaging at this point in time?
Yes, definitely. So the imaging, nuclear medicine imaging for a condition like osteomyelitis actually goes beyond bone scan. We also have infection imaging. So you have like labeled white blood cells. So you have white blood cells that are labeled to radioisotopes that will accumulate in areas of infection.
Okay.
So we call that infection imaging because it is beyond bone scan. And these are definitely indicated in patients with osteomyelitis, both pediatrics and adults. Yeah.
So at this point in time, we say that there are other imaging techniques for bone disorders that nuclear imaging does.
Yes. So we have isotopes that are for infection imaging. On the SPECT side, apart from the bone scan, we have other tracers, and then also for PETs, you have other tracers as well. And also to remember that our conventional PET tracers also give information on metastasis to bone. So for example, our most common PET tracer is called FDG, fluorodeoxyglucose, which is labeled to F18, which is the radioisotope. And it is a mimic of glucose. And as we know from the normal behavior of most cancer cells, they are hungry for glucose because they need glucose for their metabolism. So we use this tracer to find cancer cells and then in the diagnosis, staging, and monitoring of various cancers. So for example, a condition like breast cancer, where the bone metastasis can be either osteoblastic or osteolytic, meaning that you have increased bone formation or destruction in the bone, bone scan and FDG are complementary. So you will need to do both because your bone scan will give you information on the osteoblastic changes, and then your FDG will give you osteolytic changes. So yes, nuclear medicine has lots of tracers for the bone.
Dr. Martina, I don't know how we want to keep her in Nigeria so that we can. So she won't be, yes. So, but of course, knowing fully where she's a Nigerian, and at any point in time you come to Nigeria, we'll always have you here.
Keep a date with the physicians?
Yeah, of course, you have to keep a date with the physicians. Everybody, you know, we always bring you the very best. If we have to, you know, take this, we have to make sure that we have to go on and on. So let's keep a date with the physicians. We'll be right back after this time out.
I don't understand. I don't even have an idea what that is.
Okay, that's the weirdest question I ever heard. Nuclear what? Medicine? Okay, I have no idea about that one.
Every day and in every way, enjoy that I fight support. No matter the role you play, you jump back supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where of course your health is our business. With us in the studio today is the amazing Dr. JALEELAT MOMODU, who has been schooling us on the role of nuclear imaging when it comes to bone disorders. And before we went on break, she was telling us major things regarding how you can do this imaging, and you know, portraying us the functional part of it and the difference between that with the regular CT scan that you already know. Dr. JALEELAT, now I want to bring us something quite pertinent that I came across. How do you, the role, like the positron emission tomography, which is the PET. If you hear saying PET, it's just, you know, a type of the imaging we have. How does this scan detect bone metastasis from other cancers?
Okay, so it's PET imaging, like it uses radioisotopes, which are different from the isotopes we use in SPECT imaging. The radioisotopes we use in PET imaging
Before we
have...
move on, SPECT, please let our viewers know what SPECT, because
SPECT is
PETs.
yes.
single photon emission commuted tomography. So it's both at nuclear medicine imaging. The main difference is in the type of radioisotopes we use. So for the SPECT imaging, we use lower energy radioisotopes, which have a lower half-life compared to the PET tracers which have a higher energy, and because of their higher energy, you have better image quality with your PET imaging. So they are used for both. We use both in nuclear medicine departments. It's just depending on the indication and the type of information you're trying to get, then it determines which of them you use. So for PET imaging, the radioisotopes we use are different. There are so many types, but they are selected depending on the process we want to image. For cancers that are metastasizing, depending on the type of cancer, you can image glucose metabolism using FDG, which is an analog of glucose. So you tag that to a PET isotope, which is fluorine 18, and then you can image glucose metabolism. So anywhere the tracer is taking up, it shows that there is increased glucose metabolism. So in cancers that use up a lot of glucose, by extension, their metastasis to bone will also use up a lot of glucose.
Sure.
Another process that we image is angiogenesis, or increased blood formation, because we know that cancer cells tend to develop their own blood supply as a survival mechanism. So we have tracers that target this process for PET imaging, and then we can image and determine if there is metastasis from these cancers. Another type of process we target is actually receptors. So specific cancer cells have specific receptors which allow them perform their functions. So for example, prostate cancer cells tend to express what you call PSMA, which is a receptor. So we have tracers that target this receptor. So if you have prostate cancer and there's bone metastasis from prostate cancer, anywhere you have these metastatic cells, if you use your PSMA tracer, you'll see the sites. Another type of cancer is neuroendocrine tumors. They have special types of receptors as well, called somatostatin receptors. So we have special tracers that target those receptors also. So we do not image bone metastasis alone using PET, although there's one tracer that does that, which is an analog of hydroxyapatite, which is sodium fluoride. It's tagged to F18, and then it can image bone tissue and hyperactive bone tissue. But we also have other tracers that are more related to the disease, but can pick up bone metastasis as well.
Okay, now you've talked so much about metastases, and oftentimes when we know that when it gets to a stage where you have metastasis, it's almost like the end stage, right? So what role would you play when it comes to palliative?
Okay.
Is there a room for palliative?
Yes, thank you for that question. Yes. Nuclear medicine therapy right now is usually, most of the indications are actually after all the other conventional therapies have failed. So that's where nuclear medicine therapy comes in.
Okay.
So in patients who have advanced bone metastasis and they are not responding to other treatments anymore, or this is recurrent disease that other treatments have failed, you can use nuclear medicine therapies to alleviate bone pain, increase quality of life until, so this is the palliative aspects of it. And also for primary bone malignancies, so these are primary bone tumors which are advanced. Other methods of treatment are not successful. Nuclear medicine also plays a role. So we have different isotopes for different conditions depending on the indication.
So do you have people actually come to you for this?
Yes, absolutely. So I'm trained in nuclear medicine therapies, but in Nigeria, nuclear medicine therapy is not very common because we do not have infrastructure in place for it, especially in terms of treating these bone bone diseases, bone metastasis and primary bone cancers. I'm not sure there's any center in Nigeria that offers that therapy.
Do you think the government has a role to play in others?
Absolutely. Nuclear medicine is a specialty that's very capital intensive.
Okay.
So government support in actually investing in the infrastructure, which will now enable private sector to come in, because the infrastructure is already there, so they can set up centers and then piggyback off the infrastructure set up by governments will actually be very helpful.
Okay.
Yeah.
And I think that is just the way to
Well, you know, you talked about
it's oncology and it's neuroimaging, and we can see the huge benefit it plays in either diagnosis, in treatment, and also in palliative care.
Okay. Because like in Nigeria now, I know you are just like 22 doctors on this field.
Yes.
Do we have more centers available?
We have nuclear medicine centers in Ibadan, UCH, in Abuja, in National Hospital. I know those two. And then in Lagos, there are a couple of private nuclear medicine centers as well.
Okay, you know that much. Do you think there's a private partnership?
I'm not aware of any public-private partnership. There might be, but I'm not aware.
So the one that they have in Ibadan, UCH,
is government. It's government. Yes.
So with nuclear medicine imaging, have there been any recent advancement in technology that could easily detect bone disorders or even their metastasis? Because we know technology is the way to go now, innovation and recent development. Any recent technological advancement?
So the technology is always improving because, number one, we're trying to reduce the amount of radiation we administer to patients without compromising on the quality of images we get and the diagnostic accuracy of these images. So what the technology has really advanced in terms of the sensitivity of the cameras we use. And then with AI, we are using AI in image processing.
Artificial intelligence, please, that's what.
We're using AI in image processing such that you can give a fraction of the dose of radiation and still get good quality images that you can interpret. So that advancement is going on. And then there's also advancements on the radioisotope side. So this is the pharmacy side of things, where as we understand more of the tumor biology, we're developing tracers that target these tumor behaviors. The one which is like the buzz now is FAPI. It's a fibroblast activated protein. So it targets that because in the tumor environment there's fibroblast activated protein. So this this tracer, which has just been developed, and they're using it a lot to see which cancers you can image with it and get good results. That's the tracer that's on now, but there's still many other tracers that are being developed.
Okay.
Thank you so much, Dr. JALEELAT MOMODU. We will be here like a whole day.
Yes, a whole lot.
You are talking of two major trends that are very relatable. Why is it that oncology is a big thing? Even if you don't know anything about oncology, cancer is the word.
Exactly.
And that is something that people are no longer seeing that it's a big man's disease, because anybody can have cancer.
Yes.
For some genetic reasons, for some environmental
lifestyle
and all. Not only that, then nuclear medicine and of course molecular imaging, which is something that still sounds very big and bizarre, because the thing that most people talk about is chemotherapy, radiotherapy, but they are not really even narrowing it down that this particular aspect of medicine is so important and so significant in diagnosis, in treatment, in rendering therapy.
So what I actually want to add is seeing how important this aspect of medicine is. I think it should be part of our residency program.
At least start with radiology.
Yes. If we can do that, I'm sure a lot of doctors who want to do residency in that field will be able to, instead of living. Because if you can't do it here in Nigeria, Leaving your country is often
residency
an
in Nigeria
inhibition.
is 6 years.
Yeah.
So maybe do first 4 years, and then maybe the less remaining 2 years or 3 years or 3 years, then narrow down to nuclear medicine and molecular imaging.
Yeah.
I think
good,
and I think it's doable.
The world is going there. Nuclear medicine.
Yeah, nuclear medicine.
Yeah.
Thank you so much.
Thank you so much.
Thank you very much.
Nice having you.
To our viewers out there, you know we always bring you the best. 7:30 p.m. West African time. If you're in Nigeria, that is when this program is every Saturday. And of course, like I keep saying, don't ever miss it for any reason. Grab your neighbors, grab your friends, tell them to come and learn something. And knowledge, we always say, is power, but the application of knowledge is more powerful. My name remains Dr. Mebuna Yusuf Kadri, and of course, till next time, remain blessed.
I can't thank you enough, Doctor, for coming on this program. You have actually schooled us, enlightened us. Not only myself and Dr. Memona, our viewers out there, they've actually learned a lot. And I'm sure we'll still call on you another time if you are back in the country. Really appreciate you. And to our viewers out there, I just want to say thank you again for keeping a date with us as usual on your regular health TV talk show, The Physicians, where your health will always be our business, because we want you to keep up to date in good health. If you want to be part of this program, go on our website. We have a whole lot on that website. Just go and send us an email, like her, Dr. MOMODU. You can also follow us on our social media platforms, on our Instagram, on Facebook. We have a lot of episodes, over 280 episodes on our YouTube pages. If you have missed anyone, just go out there, your free time. Instead of working on different platforms, playing on your WhatsApp, you can spend that time, useful time, for your health, to be able to get some very, very important information. My name still remains Dr. Martina Agberie. Till next time, stay blessed.